Great. Today is all about understanding and appreciating patient loyalty and its impact on revenue, reputation, and outcomes. As part of that, we'll share some transformational experiences from Spooner Physical Therapy and some of the lessons that they've learned. So as you leave today, hopefully you'll have an appreciation for data-driven patient relationship management systems, some opportunities and ways to improve business process through feedback loops, an appreciation of patient loyalty, and some ways to use and leverage technology to accelerate the dissemination of patient loyalty metrics.
And then to add to that, you will hear about how Spooner Physical Therapy used these strategies to use Net Promoter Score tracking to improve our patient experience, increase our visits per episode, and improve our initial eval conversion rate.
Great. So let's kick it off with a poll question.
Awesome. Our first poll question today is, does your organization currently measure patient loyalty? You can answer that yes, no, unsure, or not applicable. And I will go ahead and share the results with you in just a moment. Okay, I think we're ready for the results.
All right. So a large percentage on yes. So this, for those that answered yes, this is slightly a trick question. The trick in the question is, are you measuring loyalty or are you measuring satisfaction? So the key here and what I'll argue today is that satisfaction does not equal loyalty. We know that that companies that drive loyalty metrics grow at almost 2 times the rate as those that have low loyalty scores. And so what do I mean by the difference between satisfaction and loyalty? Let me use one of my favorite examples, something's personal to me, Mexican food. So I love Mexican food, and I usually leave the restaurant highly satisfied with my chips and my salsa in my tummy, and it's a great thing. But there's only one Mexican restaurant that I will go hours out of my way, and in fact, I've been known to plan business trips so that I can frequent Torchy's Tacos. So any of you from Texas might have heard of Torchy's. I will go there any day of the week, and I will drive way out of my way to get there. And I'm telling you, you should go there as well. So now that is loyalty, and much different than just a satisfied experience. And so we'll talk more about that today. As we mentioned earlier, I'm Russell Olsen. Besides being a Mexican food fan, I'm also Vice President of Innovation at WebPT, where we're focused on helping rehab therapists achieve greatness in their practice.
And I'm Michelle Babcock. I'm a physical therapist and the Chief Experience Officer at Spooner Physical Therapy. We have 22 clinics in the Phoenix metro area. We're an outpatient physical therapy and hand therapy practice. My role really centers around overseeing the end-to-end patient experience at Spooner, or as you might hear us say, the experience from couch to claim. And I've worked in as well as had my hands in so many aspects of the business, and now my job is to manage that golden thread that connects the interactions that our patients have and the touch points that our patients have through their entire experience and relationship with Spooner Physical Therapy. And so by using Net Promoter Score tracking, we've seen some great results, and I'm going to share those with you later.
Great. So as Michelle mentioned, we talk about how do we create loyal, raving fans? How do our patients walk away from the experience they've had with our health system, with our whatever aspect they might be engaging with us on? And usually we turn to measuring the experience. So when I first met Michelle, one of the things we did is I became a secret shopper. And I went to Spooner Physical Therapy as a patient and reported back to Michelle on my wonderful experience there.
It was scary.
And we had a few learnings along that way. And so as we look at doing that at scale and how do we measure the experience, many people, and most of us in this room here, have often turned to things like a satisfaction score. And there are plenty of tools, studies, publications about how to measure patient satisfaction. And in physical therapy, they look a little bit like this, asking questions like, were you satisfied on a scale of 1 to 5 with the front office desk? Did the therapist or the clinician look you in the eye? Did they give you appropriate attention? Did they answer your questions? Was there good parking? And after about 200 questions, you'll have all the data you'll ever need to understand whether you satisfied that patient or not. And if people ever fill out the survey, then you'll get that too. So the problem with measuring satisfaction, what I've seen across many different aspects and areas of healthcare, is that there are some biases and some things that skew the results and make them not so actionable. So with the common, I guess, the accumulation of most of these is what was known as the ceiling effect, meaning essentially it's too easy to get a high score. And because you get so many high scores, then essentially there's not much actionable information you can do with the data and the information that came back. So let's look at a couple ways that the ceiling effect comes into play. So the first one is sampling bias. Especially in physical therapy, patient satisfaction scores are usually given at discharge, meaning the patient has come to 8 to 10 visits. If they hurt their arm, they're now back, they have range of motion, they're getting back to their normal daily activities. And for the most part, if you've gotten to that point, you're extremely satisfied and usually happy, and so you give great scores. So you think about this in terms of where in the patient journey are you sampling the patient and asking for the satisfaction or whether they're a promoter or a fan of your clinic or your therapist or whoever it might be. The next is environmental bias. So we know that if you ask somebody for results or satisfaction information as you're looking at them, as you're staring them in the eye, you're likely to get a higher score than if it's blinded or done after the fact. So I experienced this firsthand when I was taking my car in to get service. The mechanic at the end of service, of course, tells me how important customer satisfaction is to their organization. So important that his pay is tied to his satisfaction scores, and that his kids' livelihood and sports team depends on my score, scoring him high. He then asked me, is there anything else he can do would prevent me from giving him a high score? And then he turns the monitor around and says, now rate me. Okay? Now who wouldn't give the poor guy a good rating? And if you haven't experienced an environmental bias, you're lucky, because today at the end of the presentation, you'll be asked a question of whether you're satisfied with this presentation. And if Michelle and I aren't here next year, you'll know whose fault it is. Yes. And we're happy to stand up and stare at you while you fill out the survey, and then you can experience environmental bias. The next one is looking at sensitivity. So I'm not here to argue whether the Likert scale is right or wrong, or whether 5 stars is better than a 0 to 10 questionnaire. But I will argue the sensitivity drives action. So if you get a 5-star rating, let's say, and say I'm highly, on a scale of 1 to 5, I'm satisfied with this experience. If I rate my front desk experience at a 4, do I drive action off of that? Or is that good enough? What about a 3? If 3 is average, is that okay? Well, then is it only 2s that I'm focused on or just 1s? And so getting to sensitivity that drives action is important. So maybe you're asking yourself, should you measure satisfaction? So I think it's also important to distinguish the difference between satisfaction and loyalty. And what better way to do that than to look at an adjacent industry so nobody in here has to worry about being judged? So let's look at one of our favorite industries, the airlines. So now what isn't more satisfying than sitting crammed in the center row, snacking on some pretzels and sipping a Coke or something? You throw in some turbulence, some holiday traffic, and voila, you have one of our favorite industries. So as we look at this, we start thinking about how would the industry measure my satisfaction, whether I'm satisfied with my experience. I have 2 expectations. 1, that I don't die, and 2, that I relatively arrive on time. So arriving on time, again, not that I've ever planned down to the minute that we'll actually arrive on time, but give or take a couple hours, roughly, if I get there. So any airline that satisfies these 2 expectations will probably get a high satisfaction from me. So don't die and be relatively on time. Now, that does not correlate, and where that ends up leaving us is, well, how do I choose? If most airlines don't crash and most airlines arrive relatively on time, then how do I make my decision when I'm traveling? So then you start thinking about loyalty, and if there's no loyalty, then it goes to price. And if you're an airline executive looking to grow your business, you don't really want people judging you purely on price. So introduce JetBlue. If any of you have flown on JetBlue, you'll understand that they've taken a much different approach. So they've been a pioneer in customer loyalty metrics, and then using those metrics to implement improvements in their business. So you get personal TV, you get more legroom, you get free Wi-Fi, you have a better mobile experience. And so all of these things have driven to a more successful business. So I love this quote that repeat business can be, or behavior can be bribed. So we can offer free services, we can offer a gift card, we can do all sorts of things to boost that initial motivation to gain that customer, to drive a repeat customer. But loyalty has to be earned. And the key for me is that loyalty is a flywheel. Right? Once you get a loyal customer, so for me it's Torchy's, they paid me nothing to tell you to go eat at Torchy's, but yet here I am doing it. Right? And so the difference is customers that have poor experiences, that are not loyal, have been shown to drive higher support costs. And you have to then deal with a detractor and somebody that's saying negative things with social media and technology. The ability to amplify the negative message ends up costing businesses a lot of money. So while you have to earn loyalty, the reward and the benefit and the return is high. So now let's get back to how do we measure the experience if we're not going to look at satisfaction. So then I would look at how do we measure loyalty and what do we use, what's the tool and the mechanism to do that. So if you've heard of the Net Promoter Score, is the metric that is being used today most commonly to measure and gauge loyalty. So this was developed by one of the partners at Bain. He sat down and looked across 13 different industries, all sorts of surveys and questions, and he was focused on what drove repeat business, repeat purchases, and word-of-mouth promotion within these different industries. And he came down to one question, which will bring us to poll question number 2.
Awesome, thanks, Russell. Our second poll question is, what does a Net Promoter Score survey measure? And our response options are a patient's satisfaction with a physician's care, the success of a patient's care plan, the likelihood one would recommend the provider in question, the cost of each patient treated, or unsure. And we'll go ahead and get those results pulled up and give you just a second to respond before we review them. Okay, I think we can switch over to see the responses.
All right. So clearly most
Smart
of the audience. Yeah, it's a great audience. And I think you'll see this, and I've personally seen this as we've more and more industries and companies have begun to adopt this. You'll see this from all sorts of companies asking the question, how likely are you to promote? So if we get the slides back. So the question is simple. How likely would you be to recommend a friend, recommend our practice or service or company or product or whatever, kind of fill in the blank there, to a friend or family member? So you'll see slight variations of the wording of this, but essentially it is, would you put your personal reputation on the line to somebody you know and trust and recommend this product or service to them? And it's on a scale of 0 to 10. So how this is then calculated is essentially anybody who answers a 9 or a 10 are instantly categorized as promoters. Anybody who answers a 7 or 8 are neutral. And then anybody 6 to 0 are considered detractors. And then you get your Net Promoter Score by simply taking the percent of people who are promoters minus the percent that are detractors, and that gives you a number from negative 100 all the way up to positive 100 is the perfect score. So why I personally love the NPS is, one, it's easy to digitize. Right? So rather than having big paper forms and things that have to be filled out, you can text this question, you can email it. There's often, we say one question with a slight asterisk, that there's usually a follow-on question that says, well, why did you give us that score? And it's an open-ended question that the individual can then answer, I didn't like the parking spot, or the therapist looked at me funny, or whatever it is that's on their mind that drove that score. And then you can aggregate those scores up and then look for trends and patterns. And Michelle will talk more about how they've implemented that. Yep. You can identify trends. We'll also talk today about how there's benchmarks across multiple industries and then within a specific industry. And then what I really enjoy about this is it can be given multiple times throughout a given episode of care or over a period of time. And so we found this on the product side. When we launched a product, we found that in month 3, we had the highest percentage of promoters. So for whatever reason, in the evolution of buying the product and getting it installed and working, month 3 was the month to get that success momentum. We then followed the journey, and at month 12, we had the lowest scores. And then they kind of climbed back up, not as high as month 3, but kind of stabilized after that. And so what that allowed us to do is say, well, on month 3, we're going to be hitting all these people up for testimonials and white papers and to help amplify their voice. And then months 10 through 14, we're going to implement different customer success strategies to help figure out why we're failing in those months to gain the right promoters. And the outcomes are real. So looking across physical therapy, we found that on average, a detractor, a patient who is categorized as a detractor, attends 5 fewer visits than a patient who is categorized as a promoter. And so again, what I like about this metric is rather than looking at a 1 to 5, how likely or how satisfied are you with this service, with the Net Promoter Score, you can clearly hone and categorize the individual who responds as a promoter or detractor, and then you can implement some strategies, and we'll talk about a few ideas to do that here. So as you're looking at this and thinking about implementing a Net Promoter campaign, there's a myriad of different companies and services and things. So a couple ideas based on our experience is to think about how you're going to deliver this, what frequency, what part of the patient journey, or maybe multiple parts of the patient journey do you want to implement this? Again, thinking about the sampling bias and some of the other biases we talked about earlier. If you ask the Net Promoter's question as you're handing the patient the survey, you're going to still introduce some of those biases that we talked about earlier. You'll want to look at questions like how does it integrate with existing systems and can it be automated? Obviously, being HIPAA compliant is important because this is patient-related information. So what's a good NPS score? It depends. So if you are the cable industry, you're having a score of 10 or anything positive would be a win. Now, I don't think any of us should be super excited about being in the cable industry, and it gets back to satisfaction versus loyalty. A satisfied customer is only going to have repeat business until they find an alternative that is cheaper or more convenient. Versus a loyal customer, so if you look at, for example, Apple, if you're in the consumer electronics business, you've got to really step up your game if you want to compete with the likes of Apple. So in general, any Net Promoter Score that is positive, because it is difficult to get a positive score, is good. And then anything negative, obviously, needs work on. But I think most important is doing some analysis to compare you to your competitors. So you might look at hospitals in your area or other things that you might compete with and try to gain a blinded study, or there's different ways to calculate those scores or to get that data. But essentially, you need to kind of compare with the options that that patient has in a given geography. So if we go back to our airline industry, what happens when you focus on loyalty versus satisfaction? You'll see, and I think most of us are familiar with, Southwest Airlines, JetBlue, Virgin. These airlines are not only known for their great experiences, they also drive away bad profits. So, Southwest doesn't charge baggage fees. You can change your ticket without, paying ticket change fees. So there's all sorts of things that they do to get rid of the bad profits, which then drive good profits. And, they're some of the only airlines that are profitable. So specific to physical therapy, we found that an average score of 84 is the average. Looking at healthcare, the patients are, obviously usually getting better. There's kind of that euphoria, that success momentum that the patient has. So scores are typically higher. And so we've seen, the top 10% are greater than 90. Average is around 84. Then if you're below 75, you're way below average. So then the question is, now that I have a loyal patient, what do I do? And as we know, increasing with things online, with Facebook and Instagram and Google, online reputation management is a really important aspect. And if you don't think that your patients aren't Googling your doctors or your hospital or your clinic or wherever that you're working, you should think again. So the question is, how do we take our promoters and amplify their voice? They're probably already out there talking to their friends and their colleagues and their neighbors and promoting you. But how do we take that and amplify it even bigger? So one example of this is, again, now that we can cohort who our promoters are, who our neutral people are, and who our detractor patients are, we can implement programs. For example, let's say I want to boost local search ratings. And so to do that, I want to get more 5-star reviews on Google. And so I'm going to maybe take those patients that gave me a high score and send them an email requesting that they go to Google and fill out and share that message with the world. We've done this with Spooner Physical Therapy, and Michelle will talk more about how that's impacted their business, and we'll look at some results that we've seen. But the fact is, and we look at the Harvard Business School review, just increasing your ratings by 1 star on Google will result in a 5 to 10% increase in revenues. So the outcomes are very much correlated to driving more promoters. This presentation is not a presentation about search engine optimization and Google local search, but when we first ran this with Spooner Physical Therapy, we got all sorts of reviews, and the reviews numbers were great, but we weren't anywhere on that little local search result box. And we started asking, well, what happened? So we started looking into, well, to get the good search rating and to appear on one of the top spots on the local search, then you start needing to get into things like name, address, and phone consistency, and look at how you manage your presence with all sorts of providers. So it's Facebook's, Apple, Bing, MapQuest, all these different places that have information about your businesses. And the consistency across those is what drives some of the search and local ratings. So just quickly to talk about the output and the outcomes of this, I'll let you guess where we implemented or when we implemented the email campaign that we talked about earlier in terms of asking our promoters to share that with the world. So not only did we increase the number of people that were leaving reviews, but also the quality of those reviews. The listing scores and ratings improved also as we got the name, address, and phone number consistency. The average listing accuracy improved in terms of getting all those phone numbers accurate. You'll be surprised at how many different places have the wrong or phone number inconsistencies of your business across those providers. And then looking at results, getting back to my Google My Business, that translates into more traffic on the website. Translates to more clicks on the appointment buttons and more forms that are filled out, and gets to more patients that show up at the door, and Michelle will talk more about that. Another piece for physical therapy specifically is reactivation. So we know that 1 in every 2 adults will develop a musculoskeletal condition at least once a year. So a patient that was a patient today is highly likely to be a potential patient in the future. And so looking at how we reactivate and engage those patients and create patients for life is important in the physical therapy space. So similar like we did on the Amplifying the Voice campaign and filling out those Google reviews, we've done similar things on the reactivation side. So looking at how can I take patients who had a great experience with us, and in 6 months after their discharge, how do I re-engage them to let them know that we're still here and they can come back and visit us again. So with that, I will hand it over to Michelle for some story time.
All right, great. All right, so I'm going to share with you how at Spooner Physical Therapy we put these strategies into practice and the results that we found. A little bit about our organization. Spooner Physical Therapy is, like I said earlier, an outpatient private practice. We have physical therapists and hand therapists. We were founded in 1990 by Tim Spooner, who is our CEO today, and we are still therapist-owned and operated. Our first clinic was in Scottsdale, Arizona, and now we have 22 clinics across the Phoenix metro area. We employ around 110 physical therapists and hand therapists, which translates into about 30,000 unique patients who we serve on an annual basis. So what we found was we had trouble quantifying the patient experience at Spooner. And before we put in Net Promoter Score tracking, we eventually realized that the data that we were receiving wasn't timely, actionable, nor objective enough for us to make meaningful change and to put behaviors into place to improve the patient experience, and what we've found over time in terms of optimizing the patient experience to better serve our patients and better serve our company. So, as Russell explained, before we implemented NPS tracking, we used satisfaction surveys, which means that we distributed pieces of paper. Sometimes we emailed them, but if it was an email, it was coming from our front office. Most of the time, it was a piece of paper to our patients who completed their plan of care. So that means that they stuck with us, they completed their episode of care, which meant they were probably feeling better, and had a good outcome, and they were in our clinics already and willing to give us feedback. So guess what? Our patient satisfaction scores were awesome. 98, 99, 100% satisfaction. And if you happen to look at physical therapy satisfaction scores ever, they're usually 99%. But I realized that we were missing a huge opportunity, and we were missing potential to really get a good understanding of our patient experience. And so we implemented the Net Promoter Score surveys, and now we survey our patients 3 times during their plan of care, and including right away in their first week in their care. And that gives us the ability to get feedback very early in care so that we can make changes right away. Our ability to do this helps to improve the patient experience. It also has helped us define what the patient experience is at Spooner, because prior to using Net Promoter Score, we didn't really have a defined expectation. And then that allows us to set expectations for our team also in terms of what the patient experience means from end to end. So today, when we get a detractor score, so that's, remember, a 0 to 6 score, those patients are addressed immediately upon their response, and we talk to every single patient who gives us that feedback. And when I say we, it's the therapist themselves and or the clinic director who speaks to the patient to really understand what their expectation is and how we can better serve them so that they can get better and stick with us. Automating NPS has really allowed us to hone in on the patient experience, and what it's done also is improve our approach to patient care. When patients receive their first Net Promoter Score at the first week, typically when there's a detractor, I find that it's a malalignment of expectations, meaning what the patient expected and what the therapist was planning to deliver just didn't really come in line. And so our ability to have that conversation with those patients early on allows them to put their expectations on the table and for our therapists to really engage with their patients at a higher level to be able to meet their needs and see them through their plan of care. In addition, we use the patient relationship management software, which automates the Net Promoter surveys to communicate with our patients in other ways. So we use automated emailing and texting to send our patients information throughout their time with us. And that includes pre-appointment emails, so information about what to expect on their first visit, as well as that welcome email that you saw several slides ago that Russell showed you. That is specifically from the therapist. So our ability to individualize the communication to our patients, they get an email from their therapist immediately after their initial evaluation, welcoming them to Spooner and asking if they have any questions. In addition, we can take those patients and we can divide them and filter them in order to communicate by gender, by diagnosis code, by zip code, so that we can provide them specific information and education that is geared directly towards those patients. We stay in touch with our patients through the patient relationship management system and through their experience for 3 years after discharge. So when Russell talked about those reactivations, I'm sure if you haven't experienced it yourself, you know someone who maybe needed PT for their knee last week, and in 2 years, it's your shoulder or your back or something else, right? And if you are loyal to the company that you have used and the practice and the provider that you've used, then you're gonna go back and you're gonna tell your friends and family to go back. So we have found that by staying in touch with our patients over a 3-year time, we can reactivate them, and those are those reactivation emails, and remind them that they can come to therapy and they can come for a complimentary assessment. Let us look at your musculoskeletal needs and see if you need PT or if you need something else. So that has allowed us to reactivate them in a great way as well. And then lastly, one of the things that I find, and this isn't part of this talk, but in opening new clinics, it's been really helpful to engage with the patients who maybe live in that zip code and have been traveling further. And now they have a clinic closer to them. And these are loyal patients who are excited to have a clinic that's closer to them. All right, so when we first started with our patient relationship management tool, it was really to get Net Promoter Score surveys out and to automate Net Promoter Score. And as you can see, we improved our Net Promoter Score by 11 points since we implemented Net Promoter Score tracking in 2016, which is pretty awesome. And I have to tell you, it's easy to send the email. The difficult part is operationalizing it and putting in place the expectations for your team in terms of how to handle scores that come through, in what sort of manner, and how that then translates into improving the patient experience because of the great feedback that we're getting. So we saw some real tangible financial results actually, besides just the fact that our Net Promoter Score was going up. And if you go back to Russell's slides, when you have loyal patients, you can connect that directly to growth of a business and financial results. So one of the biggest things that we saw with our Net Promoter Score increase and our focus on the patient experience was that our patients, on average, were coming to therapy 1 additional visit per their episode of care, which, when you add that up, and I told you there were 30,000 patients, take a percentage of those who were falling off the schedule because they weren't engaged at the beginning of their care and didn't see the value in therapy. Well, now those people are staying for an additional visit or an additional 5 visits. And so we saw that our average visit per episode of care went up 1 visit. We also saw our reactivations of our discharge patients, so those patients who were coming back for another diagnosis, different than what they had experienced prior, went up by 9%. And our complementary assessments, which were those reach outs to say, hey, if something's bugging you, come see us, went up by 50%. So that's thousands of visits, which related to almost 12 times return on our investment for that system, which is pretty cool. In addition, whoops, did I go back? Oh, I hit the wrong button. Okay, there we go. In addition, we use the feedback coming from our Net Promoter Score surveys to coach our staff. And these are some other ways that we didn't even realize that we were going to get a benefit from Net Promoter Score. The feedback is the greatest. And Tim Spooner, our CEO, always says, if you're having a bad day, go read the patient comments in Net Promoter Score, because they are overwhelmingly positive, which is really great. And what that allows us to do is celebrate our therapists, celebrate our teams, celebrate in the areas where people are doing a really, really good job providing a great patient experience at Spooner. It also allows us to coach our therapists who maybe aren't understanding how to engage with their patients in the best way and who are struggling with their Net Promoter Score. Like I said, when a detractor comes through, we immediately address that patient. So this allows our clinic directors to work specifically with our therapists, and many times it's newer therapists coming out of school who have learned all the science and all the evaluation tools, but that engagement with the patient is still something that they're learning. And so it allows the clinic director to coach their therapists through that patient engagement and to help them to address the problem, to employ some different behaviors or different communication skills, and to work with the team to make sure that these situations don't happen again. We look at Net Promoter Score by therapist and by clinic, and we look at trends across our clinics and across our company. We totem pole our therapists, and actually Net Promoter Score is one of our company KPIs, as well as it's on our performance reviews for our therapists. We look at therapists' Net Promoter Score over time. So if there's someone who has a hard time engaging with patients, then we can help coach them and put some things into place, and hopefully they provide a better patient experience over time. And then we also look at Net Promoter Score from the beginning of our patients' episodes of care to later on. So our NPS surveys go out at 7 days, 6 weeks, and then 4 months. And if that is changing across time with a therapist, then we can help coach them. Sometimes it's clinical skill development that we have to help them with, and sometimes it is just engagement. So there have been a lot of things that have come from our Net Promoter Score implementation, financially, patient experience-wise, as well as even down to coaching our staff.
So great. So as we wrap up here today, I hope you've been able to look at how the data can provide transparency to what's going on inside the patient journey and experience, how you can take that transparency and begin to implement practices and improve business process, how you can really gauge the whole experience from what we couch all the way to a claim of what's happening and where maybe those service delivery shortfalls are occurring. And then again, this is more than just data, but it provides insights to allow and drive action. So I hope you enjoyed the presentation today, and we'll now open it up for questions.
Thank you so much. Thank you. Thank you very much. You have a lot of great questions here. Let me see if I can balance the iPad and this. So, and please feel free to vote up your favorite questions. We've got, I'd say, about 10 or 15 minutes, and we'll answer as many as we can. So how do you suggest using MPS for systems where patients don't particularly have a choice in treatment? So that would be examples such as trauma centers, chest pain centers in rural areas where patients don't have time or transport to go elsewhere.
You want to?
Good.
Okay.
And then I'll pipe in.
Yes. All right. So I think I guess I would relate this a little bit to the cable industry. So not that you want to be related to that industry, but looking at I would suggest still doing it. You can still implement the survey. You might choose, again, based on the setting, maybe you're surveying caregivers or family members or other people that are participating in the journey. But what it's going to do is it's going to reveal where those service delivery shortfalls are occurring and how to improve. Now, you might say, well, the patient doesn't have a choice because they just showed up here, but choices will evolve and occur. So maybe, there's, again, trauma centers are a little bit different, but, there are things that come up. Maybe you'll get a competitor that pops up that all of a sudden takes those satisfied people and gives them an alternative. And if they're not a fan, if not a raving fan, they're going to go to, another option that's more convenient or cheaper. So again, I think it's just good business practice to understand where you're evolving. And, given choice, I would definitely drop my cable company. and now that we see the internet, there's choices popping up, Netflix and other areas that are starting to drive some of those changes. So again, back to trauma centers, again, you have to look at your competitive environment, but change will occur. Things do happen, and you need to be ready for that.
Yeah, I agree. To that point, I think if you go back 10, 15, 20 years, we never thought that anyone would really have a choice or be Googling where to find physical therapy. It was always where their doctor sent them. So I think that's a good point.
Great, thanks. Great answer there. So a couple of things match together. One is after you identify a detractor, what's the process to move them toward being a promoter? And you can tell me if this goes with that, what influences the promoter scores the most?
Oh, okay. Do you want me to take that?
Yeah.
All right. So I'll start with your first question. When we receive a detractor score, our entire leadership team gets that notification via email, as does the clinic director. So I told you we have 22 locations, and so we have a clinic director in each location. So the protocol is that clinic director speaks to the therapist, and that patient is communicated with within 1 business day. Now, there's a comment section, so sometimes it depends on what the root cause is. Many times, like I said earlier, it's misalignment of expectations. And so we really expect our therapists to have that conversation with their patient, because that therapist and patient has to have a great relationship in order for that patient to stay engaged and complete their plan of care with us. So we really do start with the therapist, and we help them through it. The clinic director will hold them accountable, we'll talk them through it. Sometimes they'll have to role play if it's a situation that is uncomfortable, but we make sure to find the root of the problem. And then if there are multiple people involved, so many times it's not just the therapist, sometimes it's the front office. Sometimes it's the schedule is too busy. Sometimes the bathroom is dirty. And so when that happens, we have to involve the entire team. And we do involve the entire team, because every person on the team is responsible for the end-to-end patient experience, even though the Net Promoter Score is attached to one therapist. So then it's the clinic director's job to rectify the situation, to communicate with that patient that we have changed these things and your experience is so important to us that we want to make sure that this doesn't happen again. And then outside of that patient experience, once that patient is now taken care of and doing well and on their journey, the clinic director has to make sure that's not going to happen again. So that's sometimes changing processes, sometimes it's changing the bathroom cleaning schedule, whatever it might be, to make sure that this isn't a repeat situation and we don't get more detractors on that same area. What was the second part? Oh, go ahead.
Well, it was, what are the main influences on getting the promoter score?
Mm-hmm.
And so I heard a couple of things in your answer, but you might want to underscore the alignment in the treatment plan. And
Yes, the biggest thing is connection with their therapist and immediate engagement, as well as setting expectations from the beginning. So saying to the patient, what is it that you want to get out of your time with me? Not what our goals are, but what your goals are, and making sure that the therapist is always addressing with the patient back to what their goal is for their treatment, and setting expectations for what's going to happen in future visits.
Yeah, and I think the important piece to think about is it's not just sending out the survey question, because that's relatively easy. You can send out the question and you'll get some responses, and again, some good, some bad, you'll get some comments. But if you haven't implemented a system, a Net Promoter system, to track what do you do with those scores, who follows up, what's the process for following up, who's checking the people followed up.
Yeah.
There's a whole system that you need to think about employing to actually achieve the results of getting magnification from your promoters. So I think that's another piece to think about, is not just sending out the survey, but is actually taking action. Mm-hmm. And what I like about it compared to a satisfaction survey, you might get 2 or 3 people on your satisfaction survey that might rate the front desk bad or something, but maybe that's not really a problem you want to go address. But in that free text comments field where people are able to really express themselves about what's going on, and sometimes people will write paragraphs in there.
They're going to tell you exactly how their experience is going.
Yeah, and they will, and that helps drive trends and other patterns rather than asking 100 questions. You can really look at that data and try to mine the information from there.
Great.
so you touched a little bit on the process, so WebPT and some other things like that. I'm seeing a number of questions around that, and so I'm going to scroll and find those, and we'll do them as a grouping around the how-to and maybe some technical stuff. So does WebPT have tools to support coaching of staff? That was one.
Yeah, so we haven't offered any. We have best practices and we share process ways to implement the process, but I don't think we've added any staff coaching tools yet.
No, that'd be me. Sometimes I get calls.
Yeah.
And I know there's one here that wants to know, how does it go out? Is it email? Is it a text?
Oh. So email and or text. So we take email addresses at the beginning in patient intake, and each of our surveys will first go out via email. If the patient doesn't respond via email or there is no email address in the field, then the software will automatically text that Net Promoter Score survey.
Yeah, we've seen that we've been able to drive more responses by using multimodal approaches. So email first and then text. We've actually surprisingly found that email gets a higher response rate than text for some reason.
And someone did want to know your response rate. So
Yeah, I don't have them off the top of my head, and it varies by clinic, but I don't know what your response rates.
Yeah, ours is just under 60%.
okay,
Yep.
great. And around that, do you ever get feedback that the patients are over-surveyed?
Let you start with that one.
I don't think that we don't get feedback that they're over-surveyed, and I think that is because it's just one question, and it's only 3 times over for 3 or 4 months. What they do complain about sometimes is too much communication. So if you add in there, and this is why we have a customer journey map, and we lay out all of the communication that goes out to our patients. So if you do put in there their pre-appointment email and their welcome email, and then promotional events, and then education, sometimes it can be overload. And so we do have to address that every now and then. But I will tell you, we get fewer complaints than I would expect, and our unsubscribe rate is under 1%. So I keep sending them.
Yeah, I think that's important to look at. I think one of the successes that we've seen, not only at Spooner, but other organizations, is really looking at the map, because you have other things, birthday reminders, other emails, promotional items, that if you're not really thinking about the entire patient experience from the patient's point of view, then you'll miss certain things like, oh, I forgot we do that outcome survey, or we do this thing over here, and this other group is doing this other thing, and then all of a sudden you realize that you've over-surveyed the patient. And so really looking at the journey and the touch points along that journey, and being really careful in how you plan that out.
Yeah.
That sounds like a really important component to actually engage the patient rather than just pound them with requests. One question was, what about patients who don't have email or text capability?
We don't survey those people.
Okay.
I don't know.
I'm not sure I've
We
met
would make
many
a
people that don't have an
recommendation.
email or a cell phone. They might not give it to you, but
Yeah.
Right, okay.
And there are plenty of people actually who say, do not email me and do not text me. And so if they tell us that from the beginning, then we don't, for sure.
Let's see. So there was also a question, and I wanted to be more specific around how you use social media, or do you use social media to follow up and your amplification process?
yeah, so certainly we found a lot of success amplifying the message across Google and using the Google reviews to do that. And I'll let Michelle talk about more specific social media amplifications.
Yeah, we don't really connect our Net Promoter Score survey to Google except for what we see. So we appreciate that the patients provide reviews, and if there are, like on Yelp or on Google, if there are negative reviews, then we always respond to them. And we thank patients for providing reviews. But beyond that, can the question be more specific?
Well, I know
misunderstanding.
other organizations will sometimes direct them to Instagram and other places to help leverage those promoters
Okay.
to do more promotion for them.
Yeah, so we give them the option of Google review or Facebook. But you could do anything, really.
Okay. And related question, do you use reputation software? So I think that would be more specific. Right?
Yeah, so some of the reputation software, we talked about the search engine optimization. So when people go in, say, looking for physical therapy in my city, my state, you get back a listing of results. That's the search engine optimization piece, and that's where we get into some of those slides that talked about how is your business represented across Yelp and Yahoo and Google and Facebook, because if there's inconsistencies, then that will drive a lower ranking. And so there's software, there are tools to help optimize and manage that across the portfolio of businesses that collect that information.
And we do use a local listing tool to help with our NAP consistency, because we do have so many clinics, and for one person to manage all of that on those platforms is just not manageable.
Great, thank you. Let's spend the last couple minutes talking about your improvement journey. One of the questions is, do you use patient-generated outcomes in your service? So if yes, how so? And if not, why not?
So we use Photo, which is specific to physical therapy. So I don't know if anyone is familiar with, maybe Noel. Focus on therapeutic outcomes. And so we survey all of our patients in terms of outcomes as well. Now, that is partly electronic and partly paper. The outcomes tools in physical therapy aren't quite as progressive as the Net Promoter system, so we do the best we can, but yes, we do.
Great. The related question was, how long did it take you to move from, what was your recent high, was it 90?
Oh, we're at 90 now.
Yeah, which is amazing.
Thank you. So we have just seen our score tick up year over year. In 2016, when we sent our very first Net Promoter Score batch survey, our score was 78, actually. And we've just been putting processes in place and listening to feedback and improving things little by little every year. So it's just sort of ticked up. So it's been just over 3 years that we've gone up that far.
Great. I think in a related vein, but there's curiosity about measuring both satisfaction and loyalty, or are you measuring both or just the one?
Well, part of Photo and the outcomes tool does have a satisfaction questionnaire, which was our only satisfaction questionnaire, and that's what we did use when we were putting out satisfaction surveys. And so we use it as part of the outcomes tool because it is part of the score, but we don't really use it for anything in particular anymore.
Yeah, we've seen more and more people. Sometimes you'll have to, HCAPs and other things, you have to implement certain surveys. But again, it gets back to, are those actionable? Can you actually do stuff with the results? And so we've seen more and more organizations, they might do that because they have to. But if they're implementing a system to actually improve and to change, then the Net Promoter system is usually better.
So I haven't quite
giggling.
I haven't quite digested this one, but I'm gonna just read it out loud and let's see what we can do.
Okay.
The increase in visits wasn't due to asking a different question of patients. So what did you do differently to make this change?
Okay, so let me see if I can answer it, and then if anyone wants to ask.
I know, you're welcome to raise your hand if
Yeah.
you want to help us clarify.
So you're right. The increase in visits wasn't just about asking the question. It's about what you do with the feedback that you get. And so the fact that we survey our patients at 7 days after initial evaluation, about a week of therapy, they've had 1, 2, 3 visits. And so before, when we were not surveying those were the people who fell off the schedule, meaning they stopped coming because they didn't see the value in what they were getting from their provider, or they weren't getting better, or their expectations were different than what we were delivering. So they stopped coming. And we had no way to identify those people with satisfaction surveys that we were handing out at the end of care. So the increase in visits has to do with that group of people who we now have information on, and we can go right to and say, gosh, I'm so sorry that we are not meeting your expectations right now. Let's talk about what you need from us and what we can do to help you get better. And then those patients are engaged and stay through their episode of care. Did I answer that, whoever asked it?
We hope so, but the good news is I don't think you guys have to jet off right away.
No.
So we are going to take a moment just to say thank you. Excellent presentation. And I have a couple of reminders for you before you go, but thank you so much. Please join me in thanking Russell and
Thanks, everyone.
Michelle.